I are going to talk a little bit about proper use of a gait belt when performing transfers with residents. So with Ashley, we're going to first put the gait belt on her, and I'm going to ask her to lean forward. And if you can lift your arm, Ashley. And we're going to place the gait belt right around the level of her belly button, okay? So at first, you want the belt to go through the teeth section, okay? And then we're going to pull it tight enough to where I can only fit 2 fingers in between the belt and her body. Next, I'm going to ask Ashley if she's able to scoot forward in the chair because, as you can see, her feet are not flat on the floor. And this will help with her performing the transfer. Next, I'm going to ask Ashley to put her hands on the chair or whatever surface that she's standing from so that she can also help perform the transfer. Amanda and I are going to block her feet so that as she stands up, if her feet start to slide, she has the chair behind her, or if she's coming from the bed, you would have the bed behind her, and you would have our feet in front of her, and our knees are going to be bent and blocking her knees. Next, we want to make sure that our palms are up. We're going to place one hand under the belt in front of Ashley's shoulders and one hand in the back behind Ashley's shoulders. And on the count of 3, we're going to ask Ashley to help to push herself to standing. 1, 2, 3. It's important to also note that you want to make sure that both of your knees are bent, your hips are bent, and your back is very straight. You also want to give the patient or resident time to process your request of asking them to stand. Some residents need that extra time to prepare themselves for the transfer. Okay, we'll have Ashley go ahead and have a seat. Reach back for the chair. And as we're lowering her, we want to bend our knees, our hips, and our back as well. One of the ways that you may have been transferring residents could be turning your palm inward and grabbing the belt in this direction. And we just would like to point out that this puts Amanda at risk for a shoulder injury because you're internally rotating at the shoulder joint and then you're pulling up, and that can cause injury to that shoulder. The other thing that you may have been doing is pulling from behind. And as you can see, this then puts Amanda's arm right in between Ashley's arm and her body. Then as she would go to pull up on Ashley, this compresses Ashley's shoulder and it could cause injury to her as well. So that is one improper way to perform a transfer. Again, the only proper way to safely perform a transfer is to make sure that your feet are blocking the patient's feet, that your knees are bent, that your palms are upward, one in front, the other towards the back, and then ask the patient to help and give them time to process. 1, 2, 3, push up. Very good. And then back down.